So I decided to be a doctor when I was over at Iowa City in biochemistry grad school. I got kind of tired of the mice and the cells and the lipids, so I wanted to change, but I had no idea what I should do or how I should change, except I wanted to work with people more. So I remember on the top bunk of the Axe House where I lived, praying hard, and then suddenly I had an answer that I was supposed to go into medicine. And my first thought was, no way, I don't want to do that. And then my second thought was, don't argue with God, you're not going to win. So I went into medicine. When I first came to McFarland, we were a small family practice group, and we were in the main clinic. And one change that happened was we grew, the clinic grew. And so then Dr. Boffman, Dr. Carlisle, and myself moved over to the Family Medicine East building and joined Dr. Bird. And have been in that building ever since. So that was one change. When I came to McFarland, I noticed that there was a very positive attitude. The front desk people and the nurses, and even lab and x-ray and physical therapy, they all had seemed like positive attitudes. And the people have changed over the years, but that attitude has stayed pretty constant. It seems infectious, and it begets the new people to have a positive attitude and try to do what's best for the patient. So that's a good constant thing to have. Patients are why we're here. We're pretty concerned about doing the right thing for the patient. I'm impressed with patients oftentimes. Several patients have disabilities, and these are somewhat newly acquired disabilities. They may have had a stroke, they may have had fell off the roof or had a motor vehicle crash. They may have gotten a disease like multiple sclerosis. And I'm impressed and inspired how these people can be positive. They keep going, they deal with what they have, and they're being productive. You know, we have to have a good staff, and at Family Medicine East we have good front desk, good roomers, and good nurses that help us with all this thing, and lab and x-ray. So without all their support, we couldn't do the job that we're doing. And then I have to throw in there my family too. I have 3 adult kids, Ben, Tim, and Emily, and they have all been very supportive throughout my career, especially when things get tough. And then also my wife, Liz. So we did make it over to Iowa City, and she got to be with me ever since medical school, and has been with me ever since, and so I couldn't have done this without her. So thank you, Liz.